Hi guys, good morning. A lot of patients are writing to me, it's summertime, everyone's getting melasma again. And I think everyone forgets that this is a chronic disease. Melasma is chronic. So let's jump into it. So if you have melasma, there's a couple things that you need to keep in mind. One, because it's chronic, let's talk about another chronic condition like blood pressure, right? If you had an elevated blood pressure and you needed blood pressure medication, you would take this medication every single day. Let's switch the chronic condition to melasma. You have melasma, it's chronic, and you need to be using the topical creams every single day to help control your melasma. What are the topical creams? Let's talk about it. My most successful patients are on the following: a pigment inhibitor, an antioxidant, an SPF, a nightly retinol, and a compact, an SPF Compact. You cannot come into my office for melasma and not leave with Skin Better Science's SPF Compact, because reapplying your SPF every 2 hours is a non-negotiable. The difference we see on the patients who try to be consistent with the SPF versus who don't reapply, just apply in the morning, is grand. It is night and day difference on controlling melasma. Last but not least, hydroquinone. Hydroquinone is amazing. Can we stop with this shit that you cannot use it during summertime? You can use it. You need to use it correctly. How is that? At night only, you need to wash it off in the morning. You cannot go out into the sun with your hydroquinone. So if you're using it correctly and you're cycling it every 3 to 4 months, you're going to be okay, and you shouldn't have the ecchymosis. I can never say that word correctly, but it's the reaction from hydroquinone that makes you super hyperpigment, or sun damage from the hydroquinone. It's all about using these medications correctly. When you're cycling off your hydroquinone, you still need to be on pigment inhibitors such as tranexamic acid, kojic acid. You still have to be on the brighteners. Where people get frustrated is that sometimes on the brighteners, you will still release a little bit of pigment. We know this. This is a chronic condition. So it's about cycling your hydroquinone, trying to control the pigment the best possible. On top of that, there's a lot of topical treatments like microneedling with tranexamic acid directly into the skin. That is an incredible treatment if you can do it monthly during summer, just to prevent your pigment cells from releasing the melanocytes. So if you're struggling with melasma, we basically have aced it here. We have very successful patients. Contact us so we can help you.